Hi everyone, it is Chloe Schaefer here, and I wanted to talk to you all about the infamous DID diagnosis. So, this is dissociative identity disorder. It is not like a normal dissociative disorder. This is the one that people like to call multiple personalities. So, this is kind of like that hot topic Hollywood split type diagnosis. And I wanted to break down a couple barriers that I've had a few clients bring up about this disorder. So, rule of thumb number one is that any licensed counselor or licensed social worker or any regular doctor is not allowed to diagnose and or treat this disorder. So if somebody suspects, like just a regular counselor, if I had you come in and I thought that that's what was happening, I cannot make that official diagnosis. It's kind of like that one diagnosis that we cannot touch, because if it was a true diagnosis, only a psychiatrist is able to work with them. And that's for a lot of different components, a lot of medical complications. Um, if if you've ever heard of it, somebody with that true diagnosis, when they switch, their chemical makeup of their body changes. And it is absolutely fantastic and interesting and complex. So, someone as a psychiatrist is the only person who can treat that, because there's a lot of moving parts internally, emotionally, physically. Their entire world changes when they switch personalities. So, they're the only ones that can diagnose and treat that disorder. But I want to explain a few other things with DID. So a lot of times people might actually feel like they do switch, they have different personalities, but 9 times out of 10, those people have just had extensive trauma. And people with true DID might also have true extensive trauma as well. That's why a lot of times people think that occurs. But most people, they just build up some type of defense mechanism in their brain that takes them to a different place, a different personality, a different type of trait to help them overcome and think of it in ways that them personally they would not think of. So, a lot of times it's just a very extensive amount of trauma that creates these different types of personas that we have within ourselves. But the true switching and the true physiological change that happens is with DID. So if you really think that you might have that, you can have a regular assessment with a counselor to kind of pre-screen you a little bit to see if you have it, or if you feel pretty confident in that, you can go straight to a psychiatrist because they're the only ones allowed to. And I also wanted to bring up some interesting things with treatment. Um, with psychiatry being a non religious world, they are definitely by the books, they're scientific, they use medicine, all of these things, which is great for them. As most of you know, I am Christian, and I pride myself on that with Christian counseling. However, despite them being in a very scientific world, they acknowledge exorcism as a treatment for DID. So when all of these former, really groundbreaking scientists discovered DID and how to treat it way, way, way back about 100 years ago, they found out that a lot of times these people might actually be possessed. And it's just a really interesting concept in the science world that they do acknowledge possession as a form of treatment, because any type of demonic attachment, they are probably going to want you to be depressed. They're going to want you to be suicidal, do different impulsive things, and that's where that multiple personalities comes from. If it was a possession, is because there's a lot of different spirits or demons within you that are making you act all of these chaotic ways when you yourself are suppressed. So, exorcism and possession is a real groundbreaking thing with psychiatry. It doesn't happen often, but true, real cases of DID is extremely rare. So please have an open mind if you are going into counseling thinking that that's what's happening. Please just be open and aware that it most likely is not, but there are a bunch of other disorders that might explain why you're having these feelings or putting you into a different category of disorders. So there's a lot to discuss, but it really comes down to having an open mind of what your true diagnosis is. And you might want to shop around for a couple different therapists, see if they both come up with the same diagnosis, or inevitably, if you do feel like, if they also feel like you have that disorder, then they can refer you to a psychiatrist. So I hope that helps to kind of break that stigma down. I know it's a very cool and interesting diagnosis to have or to think you have, but just leave it to the movies, leave that to Hollywood, and leave it to the psychiatrists. Thanks, guys.